Alright, so I've been meaning to make this video for probably a month now. Quick background. So probably 2.5 years ago or so, I started to notice that I had this little, like, blemish on my face. And as someone who's grown up with acne, that was not unusual, and did not cause any sort of concern. Flash forward a couple of months and it continues, and it's not something that's going away, and it's not something that looks the way that most of my acne has looked my whole life. And so rather than get super worried about it, as I'm sure would have been easy to do, I just assumed that it was something, that was going to just be there for a while, and it was going to take some more to get rid of it. But as time passed, it didn't go away. It would sort of heal up a little bit, and then it would crack again, and then it would heal up, and it would come back. So it took a while, and it took a lot of encouragement from my wonderful wife to actually go to the doctor and have him take a look at it, try and tell me what it was. So I went to my primary care. He took a look and said, it's something, probably. Did not seem overly concerned, but said, let's send you to the dermatologist and see what he has to say. I haven't been to a dermatologist since I was in my teens and tried to get some kind of acne treatment, which didn't end up really working. But anyway, I hadn't been to a dermatologist in a while, so it made sense to go anyway. So I go to the dermatologist, and he takes a look and says, I would, if you were 60, I would just look at you and look at the blemish, which is here, by the way, and say, oh, well, that's probably a basal cell. I had not heard the term basal cell, so I didn't know what that meant at the time. So he explained a little bit. It's a basal cell carcinoma. It's a form of cancer. Some people call it pre-cancer. But it was something that, they were going to take a biopsy and test for. They did both of those things, and it turned out that's what it was. The reason he mentioned the 60-year-old thing is because it's not common for someone of my age to have basal cell carcinoma. That being said, it is very common of someone of my complexion. The original kind of consult that I had with the person who brought me into the dermatologist's office, the nurse who would give ask all the basic questions. Her question was, so, have you had a lot of sunburns? Yes, I have had a lot of sunburns. So again, it's not something that somebody my age would normally get, but it's certainly something that someone of my complexion would certainly suffer from. So they do the biopsy, they send it away. A few days later, they come back and say, yes, you have a basal cell carcinoma. We're going to go ahead and get that taken out. So to sum up, I would not recommend necessarily looking up like pictures and photos of these. Essentially, a basal cell carcinoma is a cancerous growth underneath the skin in the first few layers of cells underneath the skin. And it presents itself with these sort of blemishes that come through the skin. It doesn't necessarily grow very much, if at all. It can't spread. It can't become malignant. So in terms of cancers, it's like the paper cut of cancers, I think, is the best way to describe it. I don't want to diminish anybody who's had horrible issues with basal cells, because I'm sure that they can probably be terrible. But it's not something that you would necessarily be super concerned about, and no one has been super concerned about it along this process, which has been great. Everyone's been really nice. I've had a really good experience. But anyway, they said, we'd like to get surgery for it. We're going to, prescribe, or we're going to have you do Mohs surgery. I think it's M-O-H-S, Mohs, not M-O-E'-S, Mohs, that takes place at Mohs Tavern. Basically, they take a layer of tissue, they test it while you're there at the office, and they make sure that they've gotten all the cancer cells, and if they have, they sew you up. If they have not, they go through and they take another layer of tissue. And then generally reconstruction is done right there if necessary. So let's travel back in time with me a few months after the dermatology appointment, when I was first going in for my consult with the surgeon at the medical center. So over to Derek from a few months ago. So, headed to UVM Medical Center to find out a little bit more about how this whole process is going to work. Also, I'm vlogging in the car, which is not something I've ever done before. Headed there to find out more about this whole basal cell carcinoma thing, determine what the process is going to be like in getting it removed. Not really sure what to expect from that other than the basic research I've done online. If you have an opportunity to research basal cell carcinoma or a need to do so, I wouldn't recommend an image search. Don't do that to yourself. It's not a good idea. Not really nervous about today in any way, because I don't anticipate anything happening other than people poking at my face and looking at my face with some kind of glass and a bright light. But I am a little bit nervous about what they're going to tell me in terms of what they expect to have to possibly remove to get this whole thing out. I don't know what's going to happen. It's in a horrible place, so we'll see what they say. I don't have to do a lot of doctory type things, and so when I do have to go to the hospital and chat with someone about my health and the future of my health, it's nerve-wracking. I think for anybody it's nerve-wracking to go and talk to somebody about stuff that's going to impact the rest of your life, whether it's medical or a job interview or something with school, any of that stuff. So yeah, we'll see what happens. I'm not super nervous, but I wouldn't say I'm relaxed about it. Yeah, so more to come, maybe. So that was pretty quick. Already back in the car like 25 minutes later. No surprises. Surgery scheduled. Essentially gonna cut it out parallel to my lip or perpendicular to my lip, and hopefully just suture it shut from what it sounds like. So that's good news. He did make this motion regularly, so who knows how long this scar is going to be, but it seems like probably like that, and then under my lip. Talked about just healing. They will have to put sutures in that'll have to be removed because he doesn't want to put anything in that's going to dissolve because they'll be in my mouth. Yeah, so all very positive. Super low-key guy. More low-key than I might prefer, actually. But super nice guy. Doesn't expect any complications at the moment. Of course, things change when you get in there, and maybe it's larger than they think, etc. He did indicate that it was a little more aggressive. What did he say? Basically, it gets into the skin more. That being said, I have limited skin here. It's not like I have tissue underneath it that would be an issue necessarily. So we'll see. He didn't seem to think that there would be anything but cutting a swath out and then suturing it together. Small scar, obviously, but nothing horribly dramatic, he didn't think. So we'll see in a couple of months. All told, no surprises, really. Now back to work. So that's where we are. The surgery is tomorrow. They had originally scheduled for something a little bit later in the month. Called me up a couple weeks ago and said, hey, the doctor has to be out that day. Can we reschedule? And so now I'm headed in tomorrow. I don't totally know what to expect. As you could probably get the vibe from that previous video. Essentially, they're going to do an incision. They're going to take some cells, take some tissue, and then if they've got it all, great. If not, they're going to keep going until they get everything out. Recovery time, no one's really sure how long it's going to take because they don't know what it's going to look like when they get in there. So if it's really minimal tissue that they need to take, it'll probably be pretty quick. If they've got to do any significant reconstruction, it'll take a little bit longer. So, I'm not I'm gonna try to stay chill about it and try to not make any assumptions, but we will see what happens. And depending on how I feel and how the process goes, y'all may come with me. So we'll see. But we'll see what tomorrow morning brings.
This is where they're gonna do the actual surgery.
Yeah, it's gonna be right here. Oh, right here, mostly. So I should mention at this point that if you don't particularly like sort of surgical procedures and the resulting video that might, match up with such a procedure, perhaps fast forward a bit. It's probably in your best interest. Yeah, that is a good look. So we've numbed things up a little, more than a little. I have this thing on my hand now, which apparently lets them cauterize this afterwards. So I think I'm sort of like a lanky battery at this point, from what I understand. So that's exciting. I'm all blotchy. That's cool. That must be me being stressed out. So here's the situation. Yeah, it's a good look. Exciting times. Hannah, your thoughts?
I think you look wonderful.
Oh, that's very sweet of you. Thank you. So we're through part 1. Took a sample here. They're gonna do the pathology and see if they got everything out. If not, do another run at it and wait again. So just a waiting game now. Not too bad. It was pretty quick. No real pain. Definitely an interesting sensation, and this is just super comfortable, as you can imagine. But we'll see what they say about the test. So this is a look. Yeah, look at that. Sweet. So surgery went well. Got everything on the first pass. Yay, that's exciting news. Headed home now. The closing portion of the show was significantly more involved than I was prepared for. I suppose in my research, I had seen a lot of photos of people who had this done. And no matter the size of the spot, there's always like a giant scar because they've got to make it look good as well. They want it to heal and look as good as possible. And in doing that, you got to do a lot of other things. So they had to essentially make an incision down here, and so that they could move some tissue kind of up to fill this space. And then in my lip, they had to actually make an incision as well so that they could kind of push the lip forward so that by the time it heals, it will look as normal as possible. Probably, all told, we were there for about 4.5 hours. The closing part was probably close to 2 hours of just suturing and cutting and...
Procedure was 4.5 hours, but we were there for about 5 hours.
Yes, that's true, yes. Hannah, like a trooper, in the room the whole time, being subjected to what I'm sure was a complete horror show, based on the amount of pulling and such that I was subject to. I can only imagine what it looked like.
There was a lot of blood.
Yeah.
Yeah, a lot of blood.
Yeah. So I would not have done well with that, but Hannah's a better person than I am. So.
No, I'm just less squeamish.
Okay, well that's also true. So that's the situation. Headed home. Basically just need to take care of it now for the next week or so it can heal up. But it's gone. I don't have to think about it anymore. Yes, it's exciting. So.
And what are you gonna do from now on?
I'm gonna wear sunscreen. Yes, I'm going to wear sunscreen.
And a floppy hat.
I mean, I'm just a normal hat, if that's okay with you.